Okay, great. Good evening and welcome to tonight's workshop of the Board of Education. At the request of the board, Dr. Arlotto will provide an update on plans to fully return students to in-person instruction for the upcoming school year. This workshop is being streamed live on AACPS YouTube channel. If we are interrupted during the broadcast, the meeting will be stopped and we will take a short recess until we can continue. If for some reason we cannot continue, we will notify you as soon as possible when a new session will be scheduled. The board attorney has asked that I read the following statement. The Maryland Open Meetings Act, a state law, requires public meetings to be open to the public and to be held in places reasonably accessible to individuals who would like to attend these meetings. Tonight's workshop is being conducted in this live streamed virtual format due to members' previously set schedules balanced against the determination that this update was needed before the next regularly scheduled meeting in light of recent developments regarding efforts to combat the coronavirus. The board attorney has opined that the public access provided by available technology makes this virtual meeting reasonably accessible to the public and provides appropriate opportunity to observe the conduct of the board's workshop consistent with prevailing best practices during this unforeseen situation, and therefore complies with the Open Meetings Act. At this time, I will do a roll call of members to determine who is with us this evening, beginning with Mr. Silkworth.
Yeah.
Ms. Frank?
Here.
Ms. Schalheim?
Here.
Ms. Omisori? I'm sorry, I didn't hear. I don't have. Ms. Omisori is present? I know she is present on this call. I have not seen her unmute to answer. Dr. Tobin?
Here.
Ms. Corkadell?
Present.
And one more time, I'm going to check. Ms. Omisori, can you hear us? I believe she might be having a technical issue and is going to try again to join us. And while she's working that out, I want to take a moment to recognize, I think it's important that we acknowledge the very deep loss we're all experiencing right now. This is the first time we've come together in a meeting since losing Miss Antwine. And while we have a much more prominent and appropriate recognition of our colleague planned for the August 18th meeting, I think it's important to acknowledge how difficult this is for us. Ms. Antwine, this work was extremely important to her. She was passionate about it. She brought an energy that really is going to be missed in this meeting and all meetings going forward. But we're going to carry on because this work was so important to her as it is the rest of us. But just wanted to take that moment. Ms. Omisori, I see you've joined us again. Are you present?
Present.
Great. We're good to go. So at this time, I will turn it over to Dr. Arlotto, who's going to talk to us about the school in beginning in September.
Thank you, Mrs. Ellis and members of the board. Let me recognize that we have Dr. Kalyana Raman has joined us, and he is going to spend some time with us this evening. So thank you, Dr. K. I think the best way to utilize your time is the board submitted a number of questions over the last 24 hours. I've spent some time trying to put them into like groups so that we can have a conversation about them. I'm going to pick out a couple of those groups, talk about some of those responses because they may relate directly to questions you have of Dr. K. Then we can let Dr. K go about his business for the evening, and then we can get to some of the other questions that are more sort of directly school related. Does that make sense? Is that okay?
Sounds great.
So,
And I do want to acknowledge, thank you so much, Dr. K, for being here with us again this evening. We appreciate it.
So three groups of questions that I think will directly relate to the work of Dr. K, his advice to us in our work in collaboration with the Department of Health throughout this entire piece. There were questions regarding masking, questions regarding testing, and questions regarding contact tracing and quarantining. And so I'm going to respond to several of those questions, and then we can certainly we can open it up and let Dr. K answer any of your specific questions if I've not been able to address them. So beginning with, and many of the masking questions that were asked by the board the responses are as they were last spring when we went to hybrid and students returned to the buildings and they were in masks. Many of those same protocols and procedures will be in place as we plan to go into the fall. And students wearing masks at all levels, elementary, middle, and high school. One of the questions from one of the board members was, what happens if students are wearing their masks incorrectly or won't comply with wearing a mask, as has been in the past, or in any time a student is not complying with rules? We will work directly with that student. We'll work directly with that student and their parents. The teacher, a counselor may be involved, but we want to first educate the student about the importance of the mask and why it's being worn. If there is difficulty with the student and their inability to wear a mask, we'll work directly with that student and their parent. What guidance will school administrators and classroom teachers be given regarding masking and mask breaks? Certainly, as I've already said, masking will be required throughout the school day. And that will include students as they are walking through those public spaces from their classroom to the art room, to the cafeteria, to recess. They'll be wearing their masks. When they go outside, whether it's for recess or for PE, or their teacher takes them outside, they can take their masks off. Will masking requirements, when will masking requirements be reevaluated? And they'll be reevaluated as the advice of the public health experts changes. We did that throughout the winter and spring of last year, and as that advice changes, we are able to change with that advice in the schools. Regarding part of that question does involve metrics, and I'll let Dr. K talk about metrics in particular. Will there be mask breaks? Another question asked. Again, as students are at lunch and they're eating their lunch, they can take their masks off. Outdoor recess, outdoor PE are all sort of prime examples of when students will be able to take their masks off. And if their teacher takes them outside, many of our teachers in the hybrid environment try to take advantage of utilizing the outside as much as possible. Of course, that's all based on weather more often than not. Can you confirm that a doctor's note will allow students to be exempt from masking? And this is, as was the case last year, and as is the case with our special education service students, there is a mask exemption application process that the parent completes and meets with and they'll go through that process with their principal to get approval to not wear a mask in the building. Regarding testing, as you know, we have symptomatic testing was available in the spring. We will continue that in partnership with the Department of Health into the new school year. So if someone becomes symptomatic during the school day, student or staff member, then we have the ability, both rapid and PCR tests, be administered by the trained nurses at the school. And so we will continue symptomatic testing. We are currently working on building an in-school testing program with our Department of Health and the Maryland Department of Health. And this will be surveillance testing. This will be pool testing. And we are working on building that. The Maryland Department of Health has taken the lead across the state. They have some funding for it, and they are currently interviewing and screening vendors that will serve as the conduit. The vendor was the one that will actually be doing the testing on site, and so they will administer the test, and they will be responsible for getting the test to the lab and getting the results back. So once those vendors are identified, we will work with the Department of Health, Dr. Kay's team, to interview those vendors, pick a vendor, and then begin that process of installing a pool testing program at schools. Our plan is to start small, so we'll select a couple of elementaries, a couple of middles, and maybe a high school, start small and build that process. It's not something we've ever done before. We really don't know how cumbersome it will be and intrusive in the school day. And so we want to start small and then build, as opposed to trying to kick it off at all 125 buildings. Some of the questions related directly to that testing. Does that mean that the test, what does that mean for the testing? Well, this is a nasal swab. And so that student will have to go through that process of the nasal swab methodology. The question of who be screened, a great question. It would be for those students and staff members that are unvaccinated, number one, and two, that volunteer or agree to be part of the testing pool. So the next question, if a parent, does a parent need to be present for the testing? The answer is no, but are parents required to give consent? And the answer is yes. So it's two parts to that. One is that if the person must be, student or staff member must be unvaccinated, and two, they must agree to being part of the pool. Once we have those consent forms in hand, we'll then have to build the pool. Basically, we're gonna have to build a random draw at each school, and we will weekly draw a number of students based on the input of Dr. K and his team and the vendor, and those individuals will be pool tested randomly at each of the schools weekly, is the current plan. More to come on that. And certainly lots of questions regarding contact tracing. So the basic contact tracing protocols for adults have not changed. There will certainly likely be positive cases in schools, just like there were last spring when we opened in the hybrid modality. We will most certainly see positive cases in schools, both of staff and students. And so the basic contact tracing works such that that person that we are notified is test positive will have to isolate for 10 days. That's the positive person will have to isolate for 10 days. Those students are those folks that are within 3 to 6 feet, or within, I should say, 6 feet of the test positive individual will have to quarantine for 10 days. So there's isolation, that's the person that tests positive. And there's quarantining, and that's for the person or persons that are considered close contacts after we've gone through, and in conjunction with the Department of Health, after we've gone through the contact tracing process, they'll have to quarantine for 10 days. So some of that has changed. So what's changed? So if that close contact, that adult, is vaccinated and asymptomatic, that adult does not have to quarantine, but it's recommended that they get tested within 3 to 5 days of the known exposure. So the caveat being that if they are vaccinated and asymptomatic. For students, and this is what has changed for students, is that if that student is with, that close contact is, that student is within 6 feet of the positive individual, and both the student and the close contact are masked, the close contact does not have to quarantine if they're asymptomatic. If they're both, or either, if they're both unmasked, then the quarantining still applies. But if they are masked and within that 6-foot radius, then the test positive person will still have to quarantine, will still have to isolate, but that close contact will not. And that's an important change in what we were going through previously in the spring when we were opening the hybrid model. So I'm going to stop there as those sort of 3 big buckets and see if Dr. K has anything to add, or more importantly, correct me where I was incorrect. And then certainly I'm sure he's glad to take some questions on the board as it relates to those areas. Dr. K?
Yeah, no, first of all, thank you all for having me here. And let me just express my condolences about the passing of Miss Antoine. I haven't had as much interaction with her as you all have, but in that limited time, her dedication was clear and she'll be missed. Dr. Arlato, I think you covered those items quite well. I don't really have much to add on that. Would be happy to elaborate on one question that you noted, one around metrics. Right now, the 2 main things that we're looking at are one, vaccinations for children 11 and younger. That's going to be one of the 2 decision points, and the other is the Delta variant and what it's doing in terms of spread. That's the other thing that factored into the CDC guidance and our guidance around masking. So those are, I would say those are the 2 biggest touch points that we know about at this time that will affect masking guidance.
Thank you, Dr. K. So if everyone's okay with it, I'll call on each board member if they have any questions. Beginning with Mr. Silkworth.
Thank you. Thank you, Dr. K, and thank you, Dr. Alata, for that. You know, this is a very complicated issue with political overtones, and I'm a good listener, and I'm trying to continue to be a good listener. And I am using the most important lens that I think I can to view this issue and to make decisions. And that's the lens of safety for our students. So having said that, one of the things that I keep hearing from people, what's the science behind wearing masks? What's the data behind wearing masks? I think I know the answer to that myself, but I would like to ask Dr. K how he would respond to that.
Yeah, absolutely. So the science is there's a pretty sizable body of evidence at this point that we've collected over the past, I guess, 18 months at this point on the effectiveness of masks. The CDC has a really good summary of the evidence, and I'd be happy to share that link at the end of this session that goes through the evidence for masks in terms of decreasing transmission, protecting both the wearers and others from the spread of COVID, and that this has been seen in both in the United States and across the world. It's considered the standard globally, not just in the United States. That masks decrease transmission are an important mitigation strategy and layer of protection against COVID transmission.
Okay, thank you. So I have one other question, and that is, when this started back in March of 2020 or a year and a half ago, whatever, everybody was talking about the fact that the people at risk were the people 60 and above, and that young people were really not at risk whatsoever. And along comes the Delta. So my question is, are the young people, in terms of this new variant, the Delta, meaning our students and our young staff, are they at a greater risk now because of the Delta than they might have been in the past? And when I say that, I'm talking about if they contracted. In the past, it was said that if they contracted, that it really wasn't going to be so bad. So with this new variant, the Delta, if they contracted, is it still going to be not so bad?
Yeah. So what we've seen with COVID is that definitely younger or children or younger people overall were at lower risk than older adults. But even within that, there was still risk, particularly those with some chronic conditions. We have seen children who have died from this. We've seen some what's called the multi-inflammatory syndrome, COVID, MIS-C. We've had 7 children in Arundel who've had MIS-C, been hospitalized for that. So we've definitely seen that there are some significant and severe effects from COVID. Obviously, those rates are much lower than in older individuals or those with chronic disease. With the Delta variant, what we're seeing is a couple of things. One, we're seeing that it's more severe across all age groups. We're seeing that's particularly so for unvaccinated. We're hearing pretty significant reports from other parts of the country which have much lower vaccination rates, that they're seeing more children being hospitalized. Just because this is a rapidly evolving situation, we don't have papers or research summaries, but we know from hospital censuses from those states that they're seeing more children hospitalized. So we do want to recognize, and that's part of the reason for the masking. We do want to recognize just the increased severity of Delta across all age groups.
Thank you, President Ellis.
Ms. Frank?
Hi, yes. Can we review one more time, Dr. K, what the procedure will be for somebody who is exposed to COVID but not case positive for adults and children? I've got I just would like to hear it again as I'm going through my notes.
Yeah, it's we've gotten layers and layers of that contact tracing, so it does get a little bit technical. I'm going to start with the students first, because there are different guidelines for the students versus the adults in the school setting. For the students, if there's an allowance so that if they're between 3 to 6 feet apart, but both are masked, so both the person who is positive and the person who would be a contact are masked, the contact child does not have to quarantine if they're masked. If they are not masked, then they would have to quarantine. If they're vaccinated, then they also would not have to quarantine, but would need to continue to mask, as those are updated guidelines. So there's a lot of contingency points in there.
So can I, so when you say they're not masked, so like if they're outside at recess, and even some of our high schools had recess, that's when they would be unmasked. But if they were around someone with COVID, even at recess, they would then have to mask, correct?
Yes.
Okay. And that would be the difference between masking versus unmasking. Okay. Outside included. Okay. I think my questions were really mostly for the students. I think the adults probably haven't changed too much. The other question that I had, it's been a couple of days since I've looked at the hospitalization and case rates in Anne Arundel County. Could you review those right now?
Sure. So right now the case rate is up to, as of today, is up to 9.9, and it's continuing to climb. Just based on the data we're seeing from the hospitals, we're roughly around 20 people hospitalized, and that's been growing steadily over the past month or so. It's kind of oscillating between 18 to 22 over the past few days.
Okay, and I believe the governor said statewide we were down 84% in cases. Is that correct? And hospitalizations was, I think, more than that.
I'm not sure what the governor said. I'm assuming he's talking about the peak, but I'm not sure, what he was referring to.
Okay, and then one more question. You, in response to Mr. Silkworth's question, said that several children have died from this. How many of those children were Anne Arundel County residents who have succumbed to COVID or Delta variant?
So Delta variant, we don't have any deaths. In terms of children, I don't believe that we have any deaths, but let me confirm that for you.
Thank you. I have no more questions, President Eller.
Okay, thanks. Sorry, I was having trouble getting off mute. Ms. Dahlheim.
Thank you for being here, Dr. Colleen Raman. It's nice to see you again. As luck would have it, a lot of my questions have been answered by my colleagues so far. So, although, let's see here. So the metrics are whether or not 11 and younger can be vaccinated, which we all know that's not the case, and that's not going to be the case for quite some time, where no child 11 and under will be vaccinated in this county. And then you said the Delta variant and its spread. I guess I do have one question. In terms of the cases right now, and I'm seeing the data, I check every day. It's an unfortunate U at the bottom of that screen with a trend line with an incredibly steep slope. How many of the cases at this point in the county, what percentage at least, or roundabout, are Delta, and what are some of the, I guess the previous dominant strain?
Yeah, so we don't have Anne Arundel County specific data. We do have statewide data, and currently approximately 90% of the cases that are being sequenced are Delta variant.
Wow. Okay, great. I don't have any other questions at this moment. Thank you.
Ms. Omisori.
I do not have any questions at this moment.
Dr. Tobin.
Thank you. Thank you, Dr. Kalyan-Raman, as always, for spending time with us. This is tremendously helpful to us, and I hope to the public as well. So one quick question. Of the cases we currently have in the county, in the state, what proportion of those are unvaccinated people?
Over the past few weeks, approximately 70% of the cases are in those who are unvaccinated, or let me say not fully vaccinated. There's a small slice of people who are between their first and their second shot. About 30% of the cases are in people who are vaccinated. And that is actually different than what we were seeing during the fall. The spring, as we were vaccinating people, and even during the Alpha variant, we were seeing pretty rare breakthrough infections for people who were vaccinated.
Right.
Now it's becoming more common with the Delta.
I believe I understand this, but I think it's helpful, again, for people like me who are not medical experts, but also for the public. It is my understanding that one of the reasons to mask and keep distance when necessary is also, of course, most importantly, for those who are eligible to get vaccinated ASAP, is to give the virus fewer places to replicate. So in other words, my understanding is this isn't just about, will my child get sick, and how sick am I prepared to let them get if that's my decision as a parent. It's also that every unvaccinated person and every unmasked person is a place where this thing replicates. And by extension, if I'm following, we have, for example, the Delta because there were so many places for this virus to replicate and mutate. That's my understanding. Am I correct about that?
Yeah, so that's a good point that you bring up. Is that I'll talk about it in two ways. One is masking. Masking helps you as the person not get infected. It helps others around you to prevent you from infecting them if you're infected. And then also on the longer range scale, it helps decrease the overall transmission and mutation that happens in the virus. So variants are they're very common. It's the reason we have a flu shot every year is because there are variants of the flu. We don't really talk about that, but that's actually the reason for that. And COVID is doing the same thing. The more a virus spreads and replicates, the more mutations it picks up. Most of those don't really change how it operates. Some of them actually make it less effective. Those die off. But some of them make it more effective. It spreads more easily, it causes more symptoms, it causes more severity, and those eventually take over. And what we're seeing is because the vast majority of the world is not vaccinated yet, there is variant generation, and we've actually seen a couple of named variants that originated in the United States. And so the more we can slow down the spread, the more we not only help ourselves today, but we help ourselves tomorrow as well.
Okay, thank you. No more questions for now.
Ms. Corkadell?
Thank you. President Ellis, just as a clarification, there were a couple questions that I had submitted that were not yet addressed. Are they going to be addressed after this round of questions? I didn't want to waste time on one to the other.
Dr. Arlotto mentioned he was covering 3 specific buckets of questions. So I don't know if your questions are related to, I guess, masking, contact tracing, and quarantining, then those could be asked now, but other questions will be addressed later. Am I correct, Dr. Arlotto?
Absolutely. Or Ms. Corkadell, if you've got a question that directly relates to Dr. K while he's here.
Yeah, that was why I'm asking.
Now's the time to do that so we can let him go about his evening and talk amongst ourselves about reopening and policies and procedures as we look to reopen.
Because a couple of the questions were, so I just wanted to get clarification so he doesn't just then Dr. K is going off and and then we're kind of left with them. So I will address them then really quickly. And I'm going to combine 2 of them in the interest of time because I think they're pretty similar. And Dr. Kalyanarama, throughout the pandemic, we have experienced different recommendations as it relates to how many people in a room, how we limit as it, whether it be through the 6 feet distancing or, the masking associated with it, and what we're asking of our school communities in that regard. What conditions, you can't do a crystal ball or anything, but what conditions would you consider it now all of a sudden you and Dr. Arlotto, you're approaching Dr. Arlotto saying we need to have another conversation about what the schools look like. Last time we were kind of flying at the seat of our pants, but knowing what is possible now going into this school season, could you share just some rough guidelines of how you would be monitoring our health conditions as it relates to the pandemic and coming forth with perhaps different recommendations than our kids are back in and, X, Y, and Z. And if you could include also those extra and co-curriculars is where I'm trying to combine them, because I had a similar question for that. Obviously the state does its recommendations, but our local health conditions play a role in how you recommend. So if you could just elaborate so we know what to expect.
Sure. So we are what we're monitoring. obviously is we're monitoring our hospitalizations and our case rates in the county. But school specific, what we're looking at is cases in the schools. So we've been looking at that since the beginning of the pandemic, looking at outbreaks. And we have a definition, there's a definition for outbreaks in terms of multiple individuals in a cohort, when that's the only link between those individuals. And the outbreaks one is actually a key metric, looking at when they're spread within a school, or multiple people in that school. It may indicate community transmission, but either way, it does impact the number of kids who can be in school, those who might have to quarantine. So that's really what we're going to be keying in on in terms of what we're looking at. Vaccination rate is the other one. That's going to be a real key measure. We're looking at actually the vaccination rate by age, so by 12, 13, 14, so on. We're seeing that for 12 to 15-year-olds, the vaccination rate is somewhere around 55%. For 16 to 18-year-olds, it's in the low to mid 60s. Those are good numbers. They need to go up. And of course, as we've mentioned, for 11 and under, it's 0, and that's the big problem, right? Through no fault of their own, of course, but that is the problem that we have to deal with as well. And then, of course, we're considering the effect on families, right? Having families have kids of different ages, and so while kids in high school and middle school and elementary school might be separated during the day, they do go home at night, and they're with their siblings, and there's certainly no masking happening there, right? That's not going to happen, nor should it. But that's also something that we have to consider, and we've seen particularly in our contact tracing is that sibling exposure is actually one of the biggest sources of spread. And whenever one person in a family gets infected, it is very challenging to slow down the role of the virus in that family, because they've usually been exposed by the time they realize they have symptoms. And so that also plays into our considerations.
Okay, and then as a
Expand on
follow-up,
that, because I know, I'm sorry, Ms. Carcadell, because you asked also about co and extracurriculars. And so part of the monitoring that we, and in conjunction with the Department of Health, are doing that same monitoring. Test positive cases on a team or within a group of students, that's sort of their own independent cohort that come together after school for that activity. So if there are multiple positive cases, or in terms of a team, as you well know, and we experienced last year, if there are a high number of those students that are close contacts and have to quarantine, then that could impact a team or an extracurricular moving forward at that time.
thank you for the clarification. And then my second question that I submitted, we can knock off, has to do with the revaccination and vaccination clinics. We ran, starting at, I believe, the end of January, in a priority level, vaccinating our folks. And at some point, I presume, based on what I hear in the news at least, the necessity for a revax or for an up or a booster to it is coming down our pike. And at the same time, we're looking for that final approval to get our 2 to 11s addressed. Given the size of our school and the scope, and 14,000 staffers, and et cetera, we did have a really strong response rate, at least on the staff side, for example. I would presume we would have that same group wanting revaxed, and then possibly even those who did not want to reconsider that as they enter into the school year under the new conditions. I think it may be helpful, because we don't know when that would occur, if maybe you guys could share a little bit about the planning that goes on in the background, so that when we do get that announcement, what that's going to look like and what we can look for in way of communications of how, and timing, similar to what we did when we were getting ready, that same information as we were approaching early January of last year that you shared with us.
Thank you, Ms. Corkadell. Let me just jump in to begin. We currently have vaccine clinics going on now. And that's not just COVID vaccine that's available, but the vaccine that our 7th graders need to remain in school. So that is in place, and that's a partnership with the county government and the Department of Health. And so that's been happening at several of our schools each week. So between that and our staff vaccination clinics, those 10 weeks that you referenced during February and March of this year, we know that we can stand up clinics. Right now, we don't have any plans for vaccine clinics when schools open. Certainly, you can appreciate that with schools open and during the day, running a vaccine clinic, the logistics are for all intents and purposes, are not going to work. But we'll stand at the ready. So whatever, if there does come up if it's deemed necessary to continue that, or I think as you allude to, a booster becomes available or something required, then we'll certainly work with Dr. K and his team, the county government, to utilize our resources, our buildings, to set up vaccine clinics as best we can. But of course, when we did the vaccine clinics before and now, the buildings are basically empty. When we get into the school year, that creates obviously a different dynamic. Dr. K?
Yeah, and the other piece of it is that certainly in the first few months, there was far less capacity to deliver the vaccine. There's much more capacity now. Pharmacies, doctors' offices. We in the state have been working with pediatric practices to get their capacity up and running. Of course, as the health department, we have capacity as well. So there are going to be a lot more places that people can get vaccinated, and we can certainly talk about what we could do in partnership with the schools when the time comes for those for those less younger than 11 vaccines. The question about the boosters is a little bit more difficult to address, mainly because beyond saying that we think boosters will occur at some point, it's hard to really know what that point is, like when that point will occur and who it will be recommended for. Will it be recommended only for those at greater risk or for everybody? What's the schedule on that? So there are just too many things that we don't really know about that at this point to say more in terms of planning, other than the infrastructure exists to deliver boosters as well as primary vaccine.
Thank you. And I think that's more important than any detail at this moment in time. That would be way too preliminary, is an understanding that we've learned and grown from our first round of experiences. And we now have this wonderful database, I got to presume would be helpful in relationship to being contacted and knowing what to do. That's great. The only other question I had to do is just more of a follow-up to some of the other conversations with the other members, and that had to do with testing. Our testing, just like you were talking about the delivery of the vaccine, testing and the delivery of it and its accessibility and its ease of use have all has improved over the course of the last 18 approaching now 20 some months here, month 20. Is some of what we're seeing that efficient, the outcomes of that efficiency as it relates to testing and a better understanding of our positivity rates? Does that play a factor? Could you explain? Because people get confused with all those numbers. I just think, myself included, sometimes it would be helpful to understand how that plays a role in data, because we know data needs to have adjustments as information becomes available.
So yeah, we look at a couple of things around testing. One is the positivity rate, of course, as you mentioned. The other is the testing volume. And while our positivity rate is around 3.6 or so at this time, and it's been growing steadily over the past month and a half, our testing volumes are much lower than they used to be, around 1.34% of the population per week, something on that order. whereas particularly at the height of the worst in the winter, it was up to 4% of the population. And so I can't give you really a great formula for that, right? We know that we're always going to be missing some number of people when cases start to rise, more people get tested, all that kind of good stuff. That's why we're also looking at the case rate and the hospitalizations. But the testing has also moved largely into the healthcare space. So urgent cares, doctors' offices, hospitals, and then there's actually at-home tests as well that you can get. Particularly as more and more people get vaccinated, that testing migrates more and more into the healthcare space, right? Because that's ultimately where this is going to end up. Kind of very similar to the flu situation, but it's still going to take at least another half a year and probably longer. I mean, we anticipate that it's going to take throughout this upcoming cold and flu season to really see what that new equilibrium is going to look like, right? What does it look like with having a vaccinated population? And so the testing, while we certainly have capacity throughout the county, not just at the health department, to do that testing, it really hasn't been utilized for I would say for about 2 to 3 months in the way that it was earlier. But we are going to see more testing for a couple of reasons. One, the Delta variant is spreading, and two, it's also cold and flu season is coming up. And all of you know that when our kids go back to school, it's cold and flu season like by week 2 of kids going back to school, right? Because they start passing around all those viral illnesses. And so we're going to see testing go up for that reason as well, just because there's going to be a larger spread of respiratory illnesses in general.
Thank you, President Ellis. Thank you so much, Dr. K. I know you guys just continue to work your butts off, and here we are again, back into season. So thank you for all that you do, and I remain available, whatever I can do and we can do as a system to make it better for everybody. Please. Thank you.
So Dr. K, I think what I'm hearing from a lot of concerned parents about continuing on into a new school year with the restriction of masking. I think a lot of the confusion is it's unclear what the goalposts are, and it has felt over the last year and a half that it's changing a lot. And I know we're learning a lot over all that time, but philosophically, we're not aiming for a zero risk situation in our schools, because that never existed even before COVID. So I guess that's where a couple of my questions are. Like you mentioned the MISC, and that we've had 7 children in Anne Arundel County, I believe you said. Is that a larger number than we typically see in a flu season?
So a couple of things to that. One, we'll start with the MISC one. That's actually a syndrome only associated with COVID, and so there really isn't a good comparison to the flu for that one.
I'm sorry. I guess I was thinking that was the inflammatory response that some children have from, and which I know occurs with the flu and some other. So my apologies that I misunderstood that.
And the second is I understand the sensation of the goalposts moving. It's a combination of learning more and a combination of the virus changing. And I think that's the hard part, is that once we learn a certain amount, a new variant shows up that's doing something different. And so, it's challenging. I think with the masking particularly, we really think about it in 2 different groups. One is schools where there are children who are not eligible to be vaccinated. That creates a particular set of circumstances, elementary and middle school, versus that where everybody is eligible to be vaccinated. I can tell you that for elementary and middle school, universal masking makes complete sense in the absence of a full eligibility for students to get vaccinated, right? in elementary school, it's 100% of the population. In middle school, it's about a third of the kids, at least when you start the school year. In high school, it's a little different, right? Every student is eligible. And there was a lot of question about what was going to happen in terms of masking requirements in high school. And then the Delta variant made it that much more complicated. It's actually the reason that the recommendation around universal masking is also applied to high school is the same reason that the recommendation for universal masking indoors in public when you're starting to see spread in your county go above, for us, a case rate of 7. It's the same rationale. And I think that once we get to a place where the Delta variant is subsiding, we'll be in a different place to evaluate what's happening in the high school setting. But that we're just not there yet.
Okay, so real quick, because again, because I misunderstood, I'm sure many other people do. There is a multi-system inflammatory reaction that children do have with other viruses. Am I correct about that?
There are inflammatory responses to different viruses. The MISC that's specific to COVID is its own set of symptoms and syndrome related to COVID. It's, like I said, it's a little hard to kind of draw analogies between this viral illness and this particular syndrome and other viral syndromes.
Okay, so are we, again, I guess, so we're operating the way we are now because our numbers our case rates have gone up, and we know that the Delta variant is largely or mostly responsible for that. So if I'm hearing you correctly, and this is what I'm trying to understand and help our families understand is, again, what are we aiming towards? So do you envision that this is our future going forward, that there will be recommendation to wear masks as long as COVID exists, or are we just in a moment of sort of pause and be careful as we assess? I mean, I don't know. I'm trying to. I'm personally hopeful that this isn't, this isn't it. This isn't how we're going to operate going forward. So if you can talk to that a little bit, I know a lot of us are struggling with that.
Yeah, no, this is not intended to be the permanent go forward. I think very much that we are reaching, if not the latter stages, certainly the second half of what we're doing with COVID. It means that we're still going to need to take precautions, but we're not taking as many as we were before, right? There's reduction in the distancing as we learn more. A lot of the disinfecting services, always a good idea, but not as critical for decreasing COVID transmission, right? And so there are things that we're also peeling back. There's no gathering size restrictions. Really no activities are being restricted at all. So what we're talking about with the mask is kind of a minimal effort to decrease spread while we continue a full range of activities. And that's also in the setting of once again, not having a portion of the population, particularly for schools, right? Like it's critical, portion of the population ineligible for the vaccine. And also you have with schools, you have a particular setting where people are sitting together in a room for hours on end. That's something that workplaces, particularly those that have lots of people together in a small space, have to take additional protections in a way that if you don't have to do that, you can take fewer mitigation measures. And so there's just some features of school as well that sort of promote spread of viral illnesses that we also have to keep in mind. It's part of why, unfortunately, we got to do a little bit more with the schools, precisely because you have a population that is there every single day together in smaller spaces.
Okay, and then finally, I assume that the the decision to recommend masking for everyone in school at this time is based on some sort of a risk benefit analysis. You called it a minimal effort to, I think, try to mitigate the risk of spreading COVID. But is there at this point any research or that you know of anyone looking at what are the risks or concerns involved, particularly with children, with masking for this long? And I'm not talking about the carbon dioxide concern. I'm talking about social emotional development when children are playing together at stations and learning from each other and learning communication and interaction. I'm talking about language development. So we're talking about potential academic and social emotional effects. I feel like that needs to be on the table. I assume that we're not going to wear masks from now on forever going forward because there's no effects. There's no negative effects of wearing a mask, right? It's a risk benefit. So do we know anything, or do you know if anyone's looking at how this might be impacting particularly our youngest children in that sense?
I know that's something that's under active consideration, is obviously facial recognition, facial cues are important for social and emotional development, particularly at younger ages, right? It's more relevant the younger you are. I haven't seen any studies that suggest that there are longer term impacts, because I think part of the issue is that masks are not worn 24/7, right? It's during part of the day, and that is an important part of the day. But it is also parts of the day where they are not masking. That said, in the educational setting, masks are occurring. That's part of the balance. That's part of the balance that we're considering is what is the off ramp. And the off-ramp is very much the vaccinations, so that we can, as you know, there's no way to get to zero risk. That is neither possible nor desirable, frankly, because there's a trade-off to doing that. But we do have to get it low enough that we can truly get to a place where we can take those off. And I think the high school is probably the best example of that. We were very close to that trade-off and saying, you know what, we don't want to see spread of COVID, but we also at some point have to say the intervention is available. You've had access to the vaccine for X number of months. It's time to go forward. And so I think that with the high schoolers particularly, you'll see when we start to see Delta subside, when we can tip that balance towards taking those masks off. And for those younger kids, I would say this: if we thought it was going to be years out, I think that would change the equation. But we have a fairly confident sense that in the next few months, and that's what we've been talking about, since the vaccines first came out, was that they were really targeting the fall, and that timeline is holding. And so it's really a matter of a few more months to get that vaccine out there. And then that will once again change the balance of the equation on risk mitigation for the younger set as well.
Okay, I see a couple of hands. Hopefully there's just a couple of follow-up questions. Are you okay, Dr. K? Ms. Omisori?
All right, thank you for coming back around. Now that I've gotten to hear all the different questions, I'm suddenly developed some of my own. And I'm not sure if this is a question that's already been answered, but I know that we've talked about the procedure for students. If there's a student that is tested positive and it's been around others, what's the protocol for teachers, since they're obviously coming into very close contact, even if they might be masked, with different people? I'm talking about staff, I'm talking about students after school during sports, where they might not have their mask on. If a teacher or staff member tests positive, one that is in contact with a lot of students throughout the day, how do we decide who will then be isolated, and how do we track that type of transmission?
So for teachers or any adult, for the main distinction is that there isn't that exemption for that 3 to 6 foot. For adults, it's still 6 foot. If you're within that 6 foot distance, you're considered contact as an adult. And so I guess I'll say it this way. If the teacher is the case and the student is the contact, then it's the student rules that apply. And if the student is the case and the teacher is the contact, then for the teacher, the adult rules apply. That's why we have our contact tracing team really digs into the specifics of every one of these cases to apply the right contact tracing protocol to address that.
All right, and then one last question, and this might also go to Dr. Alato. I know that we're focusing on social distancing, making sure that students are at least 3 to 6 feet apart. I'm wondering for more populous schools that have smaller buildings. I know at least for my school, we have about 30 kids, 35 kids in one class at times. How is that going to work when we're still working with the same size classrooms that were, to be very frank, barely accommodating before we had to separate students via X amount of length? How do we still make sure that students, for at least most of their class period, aren't in a contact sensitive distance from one another?
Yeah, thank you, Ms. Almasori. It's a great question. And the answer is we're not. We're focusing on bringing all of our students back. And so that means we are going to have full classrooms. We had I won't call it a luxury, but last spring in the hybrid modality, we had less than 50% of the students in a classroom. And through those 2 days a week that they were in person instruction, as you referenced, we're able to separate them. That will not be the case this fall. We'll open schools. Our focus is to have everybody back in the buildings. And so we will not be able to guarantee, and we're not being required by the public health officials to guarantee a 3 foot or 6 foot distancing. That terminology that we've been using applies to contact tracing. So when we go through the contact tracing process, and we have a contact tracing team of folks that we have hired here for Anne Arundel County and public schools, and they work in conjunction with the experts at the Department of Health. When we have a test positive, either student or adult, we go through that contact tracing process to see who's been in contact and for how long and at what distances. And so to your point, we could very likely have increased number of close contacts because we have more students in a classroom. The good news is with masking, with universal masking, we know that the spread will be reduced and we don't have to quarantine that student that is within 3 to 6 feet that was wearing a mask. That was not the case last spring.
Okay. Ms. Schalheim?
Thank you for coming back around. Just a couple of extraordinarily quick questions, I think. Of the breakthrough cases, is there any trends regarding which of the breakthrough cases of folks that were previously vaccinated, is there a trend regarding which vaccine they had received? It's just a question, like, are we finding that one is less effective than the other? I mean, I know that there's some media out there, but locally, are you seeing any trends?
Yeah, we're digging into that. I don't have that information at this time yet, though. Okay.
Certainly when you do, I was just curious to know. And then the last question is, we did, you worked with the school system and did a really Herculean effort to get teachers vaccinated. Do we have a sense of what percentage were able to be vaccinated? And I mean, it's my understanding that it's still considered a HIPAA violation to ask one's vaccination status. Is that still the case?
It's not a HIPAA violation to ask that, but I'm gonna turn it over to Dr. Olato in terms of what those numbers might look like. We certainly don't have that as a health department.
The numbers of adults that are vaccinated, Mrs. Scholheim, is that your question?
Just a percentage, like, did we hit, a 70% threshold?
Right. So I don't have that. We don't have that information. We're not keeping that information. And it's not, we don't have, that's kept in the statewide database. When somebody goes, wherever they go, that gets entered into the database. And so we don't have access to know which ones of our staff members have been vaccinated. What I can tell you is that before we opened our first adult clinic at Severna Park High School, as you know, we sent out a survey to staff to ask them if the vaccine were available to you. And at that time, you remember, it was not available to us, but we were pre-planning in conjunction with Dr. K and his team and the fire department, the county government, as you remember. We asked that question of our staff, and we had roughly 84% of our staff responded saying, yes, they would take advantage of vaccine if we're offered to them. So that's a general number. It doesn't tell us anything other than people's intent at that time. And then, of course, you know that we vaccinated a little over 7,000 of our staff members through the clinics at Severna Park High School, which is a fabulous number. And we're delighted with that. But we know that there are many staff members that were able to access vaccines from their local doctor, their local physician. They live in a different county in Maryland and were able to access, or they went to one of the statewide sites. And we just don't know how many of our staff took advantage of that.
Okay, thank you. Sorry, just one little other teeny question. Is increased ventilation still considered a good mitigation strategy, Dr. Kalyana Raman? And if so, then I'll get into it later with our, after you're able to go enjoy your evening. I'll ask some follow-up at that time with Dr. Olato as what it is we might be doing in that regard.
Yeah, ventilation is still a core mitigation strategy that is important in school and all settings.
Okay, thank you very much. Appreciate it.
I see no more hands. Dr. K, thank you again, as always, for joining us and being here to answer our questions. It's helpful.
Thank you. Bye, everyone.
Have a good night. So Dr. Olato, we'll go back to you.
Yes, ma'am. Thank you. So since Mrs. Scholheim put that sort of out on the table and asked a question about ventilation, that's as good a place to start as any. And then I'll go back to some of the questions that were submitted by the board. And again, I've grouped those to help move us along a little bit. So it is considered a key mitigation strategy, ventilation in the schools. And so we will continue the work that we began last year in increasing airflow. And so that's one of the keys to again, I've said this before, it's not my area of expertise, airflow, but that is one of the keys to increasing or improving the ventilation. And so we are mixing as much outside air as possible. Again, we don't have closed systems, which are systems where it's the same air throughout the day, just gets pushed through a filter. We don't have that kind of system. We have all of our systems at all of our schools take in outside air. We can regulate that through our HVAC systems and our computerized, and it's all computerized. And so we will be opening those dampers. We'll continue to open those as much as possible. Every system's a little bit different because of the age of the building, the age of the HVAC system. But the bottom line is, and to your point, will be, or to your question, we'll continue to increase as much air, outside air as possible to then be able to increase the amount of flow, air turnover in the building. That also includes some filtering. So where we can, we'll increase that MERV filter. That's the rating, that's its rating. And whatever that system can appropriately handle, we'll be doing that. What I will add is that as we are preparing for the ESSER 3 grant, as you know, one of the parameters that school systems across the country can write for access to that federal money is improving air quality in buildings. And so we hope to write money into that grant. Our plan is to help us to upgrade some of our HVAC systems, replace if necessary, but increase the airflow and the air quality in the buildings. So we'll use some of that federal money to help us do that in some of our buildings. Okay, so let me go back to the in conjunction, number of questions that the board asked, and importantly so, regarding contact tracing and quarantining. Of course, is if a student has to be quarantined, well, then they're at home. And the question about attendance and how does that student continue to get, how they continue to be engaged in their learning. So let me address that. Pre-COVID, we've had students that have been sick and have been out at home, whether it's the flu or they unfortunately broke their leg and they're at home recuperating. We have the ability to continue to engage that child in their learning. And so those are learning materials that are gathered by the school, sent home, the parent picks up a learning packet, those kinds of things. That still exists. But we now have the ability to, what we have learned, and now through our upgrade in technology over the course of the pandemic, is that we can do this better. So one is the LMS, our learning management system, Brightspace, which you all, I know a number of you have engaged in some of those learning modules, those professional development modules that we're rolling out. With the Brightspace, that learning module, that student will now have direct access to that teacher, not synchronously. Don't think hybrid instruction and watching the teacher teach, but the LMS will now be a one-stop shop where the teacher or teachers, if it's a secondary student, can post work for that student. It could be assessments that the student missed that they might be able to take. They can communicate directly with the student and the parent through the LMS. And so that's an upgrade. When that student is not in the classroom, they will have access to that work that they can do asynchronously on their time. We will also, and this is in also response to a question that one of the board members asked about, are we seeking more volunteers and substitutes in the building going forward like we did this past spring? And so the answer to that is, and to combine a response to these two questions, is we are going to be increasing the number of substitutes, not volunteers, but substitutes, because our hope is, or our plan is, to assign somebody in that building that can work with those students that are out on quarantine. So it might not be their second grade teacher or their physics teacher, because they're still concentrating on the children in their classroom. But if we have an adult available that can log on, check the LMS, call that student, have a face-to-face with that student or parent if necessary, and check in on them during the day, not throughout the day and not completely synchronously, but check in and say, hey, George, did you check your work? You saw you've got something that's due in math, or you see that your reading teacher put something up, or your physics teacher put something up. Our plan is to have an adult that can check in with the students in that school that are at home quarantine. Hopefully, right? Hopefully the number is 0 on any given day. And then that substitute can be used to help with regular substitute duties. But chances are, statistically speaking, we're going to have students out on quarantine. And so this is another upgrade that we're planning for, both between the LMS and having an adult check in with that student to see how they are progressing and getting their work done, is part of our plan going forward. That then relates to the questions about attendance. How will that student be marked? If the student checks in with that adult, if the student logs in and does their work, we will consider that student present for that day. If the student is unable, not feeling well, and is unable to check in or chooses not to, then they will be marked absent. We still have to work on some clarification on that with the Maryland State Department of Education. In fact, I was part of a meeting of about 10, 12 superintendents from around the state with the new state superintendent, Mr. Chaudhry. We all met at MSD in Baltimore today for several hours, and there was a long list of agenda items. And one of them was answering this very question and our ability to, if the student engages synchronously and asynchronously on a day that they are quarantined, can we consider them present? And so we still need a little clarification on that, but that's the direction we are headed in that area of quarantine students, providing them work, and our ability to count them absent or present. There were several questions about making the virtual option available to those families that are now requesting it. And the answer is no, that is no longer available. We put out the survey because we knew we had to build the staff to meet the needs of those that had requested it. So right now, all of our classes, all of our sections in grades 3 through 12 are full. And so we don't have the ability to add anyone else to that virtual academy. That may change into the future years, but for this upcoming year, that virtual academy is full because each of those grade levels and classes are full, and we have staffed. It's like staffing a school. We've staffed that. Those classes. Classwork. Let me scroll down. Give me 1 second, please. My apologies. That we talked about. Testing. Distance. Masking. Okay. Okay, so there were several questions that were just sort of miscellaneous that I couldn't easily group with some of the others. One being, will PE classes generally be held outside, weather permitting? And that's really dependent upon the teacher. So it's not a given that because it's a nice day, we're going outside. Certainly we'll be encouraging teachers to utilize their outdoor spaces and take the students out for PE. And so we'll continue to encourage them to do that. There was an interesting question. Can parents who are concerned about their children eating lunch unmasked with their classmates check their children out at lunchtime to give them lunch at home or in their car? And the answer is no, that is not, we can't see how the teacher, how the schools will be able to, how they'll be able to monitor and coordinate that in checking a student out and checking a student back in during the midday, because so much of the staff are occupied during that lunch period, either with their own lunch or they've got the responsibility for being a lunch and recess monitor. And certainly if the school can coordinate going outside, we're going to continue to encourage recess, and recess will be expanded this year. We're going to 30 minutes of recess at the elementary level. And so there'll be more time for the students to be outside. This is a great question. What conditions would trigger a recommendation to stage down to hybrid learning? In other words, are we going back to hybrid or are we going back to virtual? And what would cause us to do that? We have no plans to going back to virtual, and we have no plans to going back to hybrid. We are planning for full implementation of in-person learning. But if a state order came about and we had to close schools, obviously we would follow suit. Or if there was an order by either the state or the health department to reinstitute the distancing requirements. Remember, that's what caused us to only be able to allow a certain percentage of students in the building and in the classroom. So if either of those two were to occur, either a state order to close schools or to reinstitute distancing requirements where we could have fewer students in the building, then as a result, we may have to go back to either virtual or hybrid learning. We are not planning on that. We certainly aren't hoping that that is anything that would occur. And I can tell you the new state superintendent in our meeting today was emphatic with the superintendents that we are to be fully operational and we should have our students back in class 5 days a week in-person learning. So he supports where we are and that work that we're doing. We talked about vaccine clinics. Let me stop there, Mrs. Ellis, and let you go work with the board to ask their direct questions.
Thank you, Dr. Arlotto. Starting with Mr. Silkworth.
Thank you, President Ellis. One of my colleagues sent me or communicated with me. We were talking about the use of ESSER funds and how they could help as we're coming back. And, you know, I taught for many years and had either the flat top desk with the chair or just the one piece. But what my colleague brought to my attention was that there are some very flexible seating options in terms of furniture out there that, this furniture would help us maximize the space within classrooms, whether they're smaller or larger. And so I guess my question is, I'm going to make an assumption that that's already come to your attention, but in case it hasn't, it's something that I thought maybe we could consider this flexible seating option.
Yes, sir. Thank you for bringing that up. That's not new, and that's not a result of COVID. That's just good practice in classrooms. And as we are building new schools and reconstructing schools, we are utilizing much more of that flexible seating at lots of different levels. And you're so familiar after you're almost 50 years in the high school classroom that those, right, sort of the one-arm bandit that we used to call them growing up, that one-arm desk and how difficult it is to get in and get out. The seating in schools has come a long way.
Yes.
And so you've taken a tour of Crofton High School, for example, and they have taken full advantage of ordering and instituting more flexible seating. So as we are building new schools and reconstructing schools, those schools have options of lots of different furniture to choose from that they see fit. So we have been instituting that, and a number of schools have taken advantage of accessing and purchasing that furniture for their classrooms that give them greater flexibility.
Thank you.
Yes, sir. Mrs. Frank.
Hi, thank you. So yeah, as a left-handed person, I hated those chairs because they're all right-handed. They're horrible.
Right.
So you did cover, thank you, Dr. Arlotto, you did cover, you know, the process for students if they're under quarantine is going to be very similar to in the past. I know last year we recorded some of our lessons, or some teachers did record lessons. If you're in an AP Chem class or an AP Physics or something where 8 days of not being in instruction could be really detrimental, do we have something to help those students who really need that instruction and that teacher-based learning?
Yeah, so that's a great question. So let me take this in two parts. The first, because you mentioned AP, as COVID began to take hold in March of 20, the College Board, who you know are responsible for creating all the AP classes and the AP curriculum, they began building review videos and content for AP students. And Ms. Amasori might be able to speak directly to taking advantage of some of those that the AP created. And so as you use the example of AP Physics, that's all, they push all of that content, including videos, out online for our students across the country to access. And so if it's a particular AP class, our students have access to that, and they have and will take full advantage of that. In terms of our own curriculum and the own teachings of classroom, that one's a little more difficult. In terms of being able to record a full lesson, we'll certainly work with teachers if they want to record a lab that they're doing with the students, or a particular lesson. All of our teachers now have that ability. They've learned how to do that because of the result of COVID. That's sort of an upgrade. So they now know how to do that, and then they'll be able to post that to the LMS, to Brightspace, for their classrooms for the students to access.
Okay, but we don't have any sort of database of, let's say it's just an average student who struggles with algebra, 8 days would be just as difficult for them to catch up, perhaps as a student in an AP class. We don't have basically a database or recorded lessons for those students. It would sort of be an as needed basis with their teacher.
Yeah, right, so there is no database like I explained the AP has, right, that they can access online. We don't have that. The teachers have access to many, many lessons that they can access, and then if they have access to those lessons, they can then build a lesson and upload it to their site, to the LMS for that student or their classroom.
Okay, thank you.
There's also access to, a lot of the teachers have utilized Khan Academy, which is an online feature where students can look up almost any area that you can think of, particularly in the area of math and science, and in particular in math, at all grade levels, and look for lessons that they can take advantage of.
Okay, thank you.
Ms. Schallheim.
Thank you. I want to go back to elementary and middle lunches if I could. And I'm a visual learner, so help me out. So obviously most of my experience is in one particular school. And that's why my question about PE came up. Before COVID, they were staggered. It was like one grade, or I believe one grade per lunch period. And so that's helpful because, it's a singular grade, you're not mixing grades, the cohorting is sort of built into that. But in terms of maximizing spacing, are we thinking about any particular strategies to maximize that, the distancing during lunch, because that is a point of concern, for the 11 and unders, if you're vaccinated, you have some level of protection. If you're unvaccinated, you have no protection at all, period, exclamation point. So I'm just wondering for all those elementary and middle school parents out there listening with a child that through no fault of their own can't access a vaccine yet.
So it will be, it's a good question, and it's really school dependent, and how they've built their schedule at the elementary and middle school level, whether they have combined lunches. If it's a small school, like you say, the larger schools, the first grade eats, and then the second grade eats, and then the third grade eats, and so on. And so they will go back to that. But the schools, the principals with their teams will be looking at spreading the students out as much as possible. What given space they have, the size of their cafeteria, Do they have a dividing wall that they can open up and spread out more? Some of the newer schools have that. Some of the older schools might not. So it's really, to answer your question, Michelle, and again, it's a good one. It's really school dependent, but we will, as much as possible, spread the students out. And that's in all aspects of the day, whether it's at lunch or the students tightly compact because they're so excited about they're in line to get their lunch. Well, maybe we need to spread ourselves out a little bit. Or as we're walking down the hallway from your classroom to the art room, instead of being right on top of each other, we'll spread each other out as much as we can, as much as possible, given the space and the number of students. But it will certainly be a challenge during the lunch period.
Okay, yeah, I appreciate that. And I know folks at home are probably grateful for that response as well. You know, and personally speaking, that was a point of concern for sure. I think I don't know that I might have more questions later, but let me just go through the list. Thank you so much so far.
Yes, ma'am. Ms. Amasori.
So going back to Ms. Frank's concern regarding the classes and the recordings, because when you talked about the AP Daily videos, I did use them a lot. The issue that I found myself running into is that typically when it comes to the topics I'm learning in class, it's a lot about the discretion of the teacher. This is seen a lot when it comes to history courses, English courses, where my teacher might be, you know, going on rhetorical analysis, but the AP Daily videos are only starting maybe argumentative essays. So I can't really use the help that I'm getting online. Of course, this might be eliminated because all those videos are out now. But for kids who are on AP who don't have that kind of standardized curriculum, I could see where that's an issue. I'm particularly thinking about math during, I guess, the spring semester in 2020, where I took pre-calc that in that period of time. So I had a whole selection of videos from the county that basically accomplished the same thing that Ms. Frank was talking about, where it was a recorded lesson of how to do certain topics. We're talking about high parabolas and things of that sort. I'm wondering, will students who are taking pre-calc, and I know there are other types of math classes that still have that same compository of videos, have access to the same videos we had during that March 2020 onward period of time in the school year? Because I know that's what we had to use for our whole math classes. Will kids coming back to school now have access to those videos?
So that will be teacher, great question. So that will be teacher dependent because the teacher recorded that lesson, posted it on your Google Classroom for you to access.
Wait, this is
Right?
a different, no, this is separate. This one was not the previous school year, but the one before. So the one that got cut in half, these videos were the same for kids all over the county. You had one teacher for all the kids taking the same class. So it's not like, oh, my math teacher at Arundel, it was just one math teacher that one video sent to all the kids taking the class of the county. Will students have access to those videos who are now going to those math courses that kind of had that set up? Because it wasn't for all classes. I took AP Stat at the same time. I had to just go to my teacher for that. But for honors, pre-calc, I believe for Algebra 2 as well, you had one teacher in the county kind of sending videos to everyone. Will students who are now taking those courses have access to those videos?
Yes. Right, because those videos exist, so we'll still be able to push those out. The teachers will have access to those, and then they can post them to their sites and to the LMS.
Okay, so they should ask their teachers for the videos, or will they be able to access it themselves?
That's a good question. Let me find out whether it's a central repository that the student can go to, or it would come directly through their teacher. My guess is through their teacher, because they would push that out saying, because you're working on parabolas at that time, and so they would push that video out or make it accessible, but let me check on that.
Okay, thank you. Let me know.
Dr. Tobin.
Thank you. And thank you, Ms. Amasari, for those questions. That was on my radar as well. So that's great to know. So I have a couple of follow-ups with the ESSER money. Just to elaborate a little more, you mentioned that ventilation, there will be upgrades. I know there were a lot of concerns last year as teachers and students were first being brought back into the buildings, that those who were in older buildings felt that upgrading the whole system wasn't fully accounting for, you know, in some buildings where rooms were kind of made out of what was originally open space or whatever. And is there any ESSER money that will be directed to, you know, particular purifiers in rooms or anything like that? Do you see that coming down the pike?
I don't see individual purifiers coming down the pike. We'll concentrate, I believe, and the facilities team is sort of hashing this out now and talking about it, about room volumes and airflow and things that are well beyond me.
Right.
But it is, I think the concentration will be on upgrades to the systems in the schools,
Okay.
as opposed to the individual classrooms. If we can upgrade the schools overall and increase the airflow, then the entire building benefits.
And there will be presumably, as I'm sure, as you said, facilities is discussing this, some sort of kind of metric or basis that they have for showing what the measures are that we're looking at to demonstrate that we're getting whatever fresh air flow the health authorities tell us is a reasonable flow for. Yeah.
Yes, I can't tell you what that is.
Right.
Yes, that exists.
Yeah.
Yes.
Again, far above my pay grade, but you know, I'm just assuming that. And also a second part of my ESSER question, and this also came from both Ms. Frank and Ms. Amasari's questions. Are we going to continue putting money into tutoring, because that's been such a valuable asset that many parents have talked about in the midst of the difficulties of COVID that has emerged? And I'm thinking both for kids who are in quarantine, but also, as we know, kids who are in a position where they're sort of catching up in certain areas. So can you just say a little bit about the status of that and whether or not we're going to be asking for money that is directed to that?
Yes, ma'am. The overwhelming majority of the monies that we plan on writing for in this grant to the state and ultimately getting access to those federal funds will be focused on tutoring for students.
Great.
ESSER says that it has to be a minimum of 20%. So 20% of the money that we ask for has to go into focused tutoring, learning loss, interrupted instruction, whatever the terminology of the day is, a minimum of 20%. I assure you, we will be asking for a much larger portion than 20% of the funds we will ask for will go into tutoring. And it will be everything from continuing the evening tutoring 5 days a week online that a number of our students took advantage of and participated in and enjoyed, improving, continuing to do that, to doing more after school tutoring with small groups or individually with students. If a student is in direct need of some individual or small group instruction, we'll be able to utilize some tutoring at all grade levels with students and staff after school, and then of course in the evenings, and then what we can access online. That will also include over the next 3 years, because this ESSER 3 money goes through to September of 2024. That will include not only during the year, but during the summer. So continuing to pay for our summer programs and summer school for students, particularly those students in needing credits either at the middle school and predominantly at the high school level, are all part of what we're writing into that tutoring category for students.
And just, I mean, that's excellent news, but just to clarify, obviously, as we said, we are going back into school. We are not planning for hybrid, but for tutoring in the evening and after school, is there virtual availability for that, or does that require a student to come in person?
So we'll now upgrade to both. So where I began was this, while last year we had online tutoring available to students at the middle and high school level 5 days a week.
Right.
Sunday, Monday, Tuesday, Wednesday, Thursday. And we had teachers at different grade levels and in different content areas that were available to work with students, and they could dial in and get online and get some help. We will continue that. Now that we'll have all of our students back in the classroom, the upgrade will be working with students in person in tutoring, whether that's after school tutoring in small or large groups. We'll have that available as well. That's part of what we're writing into the grant. So the bulk of those tutoring funds will be for stipends and salaries for adults to be working with children.
Got it. Okay. And one last quick question. So obviously I've gotten a lot of questions from various parents about why, whereas we can require, for example, other vaccines for kids to come into school and so forth, not so the COVID. And my understanding is that has to do with the emergency approval status. And if I'm understanding the news I'm reading, chances are we're going to be moving towards regular approval fairly expeditiously with Pfizer and then Moderna and then down the line. And so that makes me wonder about, to some extent, what the issues are around our adult employees. In other settings that I have been in very recently, which are private business settings in the course of my other work, and this was in DC, so masking was required, but the structure is the following. Either you prove you're vaccinated, or if you're not vaccinated, you are required to be tested weekly. And so I'm curious, as you're talking about building surveillance testing or whatever, do we, and this is we don't know where we are, but could we foresee anything like that? Because obviously that is ultimately what is going to prevent one very important part of our population from being a locus of spreading. And the more quarantines we can prevent, the better for everyone. The less illness, the better for everyone. And so I'm just curious as to if there's been discussion with the state education, with other superintendents, kind of what you're seeing down the line.
Well, thank you, Dr. Tobin. Clearly, it's now what you have described as happened at the federal level.
Mm-hmm.
As of today, with Governor Hogan, it's happening now at the state level. In those congregate settings, the 48 congregate settings that he talked about in his press conference today. So if my crystal ball is at all accurate, yeah, I can see that expanding. We see that it's happening with the county employees and the announcement of our county executive. So yeah, I think that it's something that we may see down the road and into the future, and we'll have to have direct conversations with our employee bargaining units,
right,
and work with them collaboratively on how that might work and how that will look. But certainly, I think not before it comes out of emergency status, but as you said, after that point, I think it may very well be that conversation, to answer your question, is indeed happening among superintendents and at the state level and others. And I foresee that when it gets full status from the FDA, that it may very well be a conversation we'll have directly with our employee bargaining units.
Excellent. Thank you. And thank you again for all the answers and the time you've taken on this. Much appreciated.
Yes, ma'am. Mrs. Corkadell.
Good evening. Thank you.
Good evening.
I didn't want to take up Dr. K time, but I just wanted to please ask you to extend gratitude, because even though not all of your members of staff are here or present, I know that in the background, they've been working really hard and busting butt on top of the summer sessions and the learning catch up. And by the way, we have a big giant grant to write. So thank you guys so much. It is greatly appreciated.
Thank you for mentioning the team, Dr. K, and the team, Mrs. Corkadell. You'll see that Mr. Sheknovich, Dr. McMahon, and Mrs. Jackson are all signed in and listening in.
I know, they should be on vacation. So
They're all away and on vacation.
yeah, I know. And that just goes to show dedication. You can say what you will, and our grows and glows, but at the end of the day, we've got an awesome team behind us.
Yes, ma'am.
So to that effort, we have learned some lessons along the way, and I wanted to kind of maybe consolidate a couple of my questions that I had submitted that didn't quite yet get addressed, and it's regarding communications. This is something that I think every agency, every company, everybody on the planet struggled with as we were facing many unknowns. And although we don't know what's in store for us this fall, we have since gone a long way to put systems in place and kind of improve, and it has given us even opportunities to take advantage of some of the circumstances and those lessons learned. To that effort, sometimes our community, our AACPS family struggles and expresses those struggles and frustrations in messaging and timing. We know that, I had no clue Governor Hogan was getting on the air again this afternoon, but, and we all find out at the same time. And these things happen from time to time. They tend to happen in clusters. And along the way, we've got to quickly interpret it. Can you go over, and also I want to preface by saying too, that we try to find as many opportunities as possible to engage our public, whether it be through committees, one-time project committees, our standing committees, our CAC, engaging all of our special education, CAC group that works with you, our equity committees and our task forces. They all played a role in helping us adapt. Moving forward for the school year, what can the families of AACPS staff and even the board anticipate in way of reach out and that fluid, we're a team communication, whether it's with the board, students, or otherwise, outside of what we, obviously know is available to us?
Yeah, thank you, Mrs. Corkadell. So it's really just that we have a number of robust methodologies for communication. And so we just need to continue to point our families in the community to accessing those. I will say one of the silver linings of COVID is that now people are commuting much more online, and they are going to the online spaces to get information where they may not have been so comfortable doing that, or did that on a regular basis because their child wasn't in school every day and there wasn't the backpack mail that was coming home, or even at the beginning, the regular newsletter. And then many of the principals put out their own online newsletter weekly to update their communities. Many of our families now are turning to our Facebook page. They're turning to our website. We have built throughout this time several very specific websites, and we now have another one on reopening for 2021 where there are frequently asked questions and we can push out information and schedules and updates. And so we will continue to do that. Many more of our parents and community are taking advantage of the social media posts. So our Facebook page, Twitter account, and soon to be Instagram, where we can push out information. So I think we'll continue to do that. And then I really appreciate you mentioning those existing parent groups that we need to continue to rely on, Mrs. Corkadell, as you say, that we can give information to, and then they can push out information, have conversations in their circles of influence. The CAC, the Anne Arundel County Council of PTAs, PIAC, CCAC. These are all ready-made groups that have their positive tentacles out in their communities, and we need to continue to communicate with them as well.
So that'll be something that I know, well, the ones that the board manages, obviously that's on us to reach out to them and ask them, for them to weigh in and give us that advisement time to time. So what I'm hearing is you guys are going to be doing that too, getting that feedback, because even under everybody's back to school, the learning loss component makes a lot of people look at how school is being managed and operated a little different, and how they're interfacing with our school system may be different than they had or felt needed to in the past. Does that make sense?
Absolutely. Absolutely.
So
Yes.
What are some suggestions that we can share with our constituents and that you guys are perhaps sharing on an email by email basis when the questions come in or the FAQs are not answering them? What's some good ways where people can interface as we have changed? We're back in the buildings again. For example, does that mean in-person meetings we should anticipate from counselors and whatnot, or is it do we still have the flexibility of some of those communication portals?
Yeah, we certainly have flexibility. We now want to take full advantage of both, sort of the in-person, as you say, use the counselor as a great example, that now that we're going to be back in schools full time, all of our students will have that access. And so we want to continue to do that person-to-person communication and school-to-family communication. But we also want to point our family and community to those communication tools that we just talked about. The Connect Ed messages, the Facebook posts, the website, the specialized websites, depending on the circumstance. So those are all things that we want to continue to point our families to so that they're getting that information. Then, of course, as you remember, during this COVID piece, we set up the family line, the family information line. And so that will continue to be accessible, that families can call in, and then we will get that call out to the right party, whether it's the school or here at central office or one of the satellite offices, to make sure that there's a response to that parent, to that concern. So the parent information line will continue to be in operation this school year.
Thank you. And then one question not previously reported in, but it occurred to me in its absence, actually, it sort of stuck out, has to do with equity. And we know that our underserved and historically marginalized groups in particular has had an effect. There are different numbers that we know that we need to be continuing to track along the way as it relates to getting that extra access to those available resources in those communities with those families. I know we do a good job at the school system. We get as many field people out there as possible. We just heard our report on, our field teams going out there and making that impact of difference. Could you share a little bit about that equity lens? Because we know in states of emergency, the decisions that have to be made sometimes don't have that appearance that that's going on, but I know we're doing it in the background. And could you share a little bit about some of the resources that we kind of flew through as it relates to targeting our underserved communities and families?
Sure.
The vaccination rates, for example, that sort of thing, all the way down to the learning loss, and some of the struggles that we had, whether it's English language learners or those who traditionally do not have as many at-home resources to support their learning environment.
Right, thank you. So we will, ensuring equity and access underlies everything that we are doing, right? So in every department, in every area, whether it's facilities or food service or curriculum and instruction, ensuring equitable access for our students is critical. And it's key to everything that we're doing. It's part of every conversation. And so the schools are well honed at identifying those students in need and making sure that they are reaching out along with some of the key folks, and you all know well, Mr. Vogelin and his team in student support services. So our incredible PPWs, our social workers, school psychologists, these folks and counselors are out there working and identifying students and helping families access those resources that are available. And our county is full of many resources, which is fabulous. And we need to continue to direct those families towards those resources. Likewise, we have both our Equity Advisory Committee that is a long-standing group of both members of our team and members of the public that meet monthly with Dr. Gillens and some others from our team to look at, sometimes looking very specifically at data to identify where the needs are. And I know in particular, over the past year or so, that group has really concentrated some efforts on the North County area, in particular Brooklyn Park, and some of the needs that exist there. And then, of course, there's the eliminating the opportunity gap, all that work that was done through that task force. Now, this summer, we are identifying the members of that committee, of that oversight team that was part of the recommendation of the task force. And I was able to nominate some folks, and the county executive nominate folks, and they are the ones that will begin to really oversee and hold us accountable for some of that work. And there are, of course, we've talked about this in the past. Dr. Gillens and Mrs. Jackson meet regularly with a number of community groups, whether it's the Housing Authority here in Annapolis, some of the faith-based groups, and others that we work with regularly and they meet with regularly, including the caucus, NAACP, and others that help us identify families, and then we can help connect them to the resources that are available. And we're going to continue to do that work because that work's important.
I think sometimes it just kind of gets forgotten that it's going on in the background, and in part, and also what can we do as a board to help support some of those efforts. Like I know for, and I get it, people reach out to us and say, how do I opt out? I don't want anyone spending money on food I don't need from time to time, but USDA is offering the free meals again this year for the school season. And that survey seems to come back to my mind as something being important of how we can continue beyond the scope of this year or this grant here or there. So can you maybe highlight a couple things for this upcoming school year, such as the food service that is kind of that above and beyond that seems to be staying around for a little bit?
So you mentioned the food service. We're delighted that we'll be able to offer meals to students 2 to 18 free of charge throughout this school year. And that's thanks to the federal government and the U.S. Department of Agriculture. So that's huge. We're delighted that we have that opportunity. Mrs. Reese and her team are delighted. I guess the other thing that I would, in answering that question, is our community schools program is now expanding to 12 schools this school year. So this relates directly to the Kerwin Commission. So 2 years ago, we were able to open 2 schools as community schools. We were able to add 7 more last school year for 9, and we'll now have 12 for the current school year, and that number will continue to grow. And that's directly related to Kerwin. And so there's a healthcare, a full-time nurse in each of those buildings. And there is now a community school coordinator in each of those buildings, paid for by Kerwin, by the Kerwin Commission, by the blueprint, where now that person's sole responsibility is to survey their families, determine the needs, and then help the families access those needs. And so if you've ever been to, I just happen to have just been to Tyler Heights recently, and their community room, resource room is full of shelving of not just foodstuffs, but diapers are a real need in that community. And there have been some community groups that have donated lots of diapers. So that's just a small example of the community resource coordinators in those schools. Their job is to identify a need and then connect that need with a resource. And it could be a resource that we can provide directly in AACPS, or more often than not, it's a resource that the county has or the state has, and that we can get that family and student to access that resource. So that's another upgrade, and that will happen more over time as we add more community schools to our roles.
And thank you, Dr. Arlotto. I'm just going to remind our members that we will be having a meeting on the 18th where we can get more updates. We just wanted to get some of that, some of those burning questions answered for our community that we didn't feel like could wait till then. So I do want to remind members that please do follow up with your additional questions so we can make sure they are covered. Did that answer your question, Ms. Corkadell?
Yeah, because that is something that people have been getting a little concerned about is some of those pieces. I don't have any further questions. I think they all got answered. So
thank you. Dr. Arlotto, I have just a couple. So when you sent your letter to families and it detailed when masks, well, basically that masks will be worn throughout the school day with certain exceptions. And one of those exceptions was, I believe, during strenuous practices or performances in athletics, but all other physical activities, I assume, if I understood it correctly, like PE class will be conducted with masks on. So a couple of questions about that. I've heard a concern that perhaps some of our gyms, I know of at least one, doesn't have air conditioning, and there's a concern there that that may be just simply too strenuous for students. And then students who have asthma, if you could speak to that, should, if there's a concern there, should they request an exception through their school?
Yeah, so take the second question first. If there's a medical concern, then the parent should reach out to the school and have that conversation. Regarding gyms, we have more than one gym that's not air conditioned. As many of our buildings were being built back in the day, gyms were not, air conditioning for gyms was not funded. That's a fairly new occurrence in the school construction world. So we do have some gyms that have been retrofitted, but many are not air conditioned. And so the teacher will have to take that into account. Yes, the advice that we are getting are, if you're indoors, you should be masked. For those certain circumstances where that strenuous activity, like athletics, it could be volleyball, for instance, they could take their masks off while they're in competition, but when they come sit on the sideline, the requirement would be they'll put their mask back on. That's the recommendation that we're getting. So the PE teachers will have to think very carefully about what they're planning and scheduling on any given day. And if they can take them outside for that strenuous activity so they don't have to wear a mask, and do something different indoors that's less strenuous, so it's less of a burden for the student.
Okay, thank you. And finally, obviously, as you know, there's concerns in many different directions. We've certainly had a school community largely divided on what we should be doing, how schools should be conducted, what restrictions should be in place. So there are many opinions, but I am hearing from parents on one end who think we should still have a virtual a virtual option because understandably, they don't see a difference from where we were last school year to where we are now with numbers increasing. And so they have that concern. And then we have parents who understandably have concerns about their students needing to wear a mask all day. And so I've been in tune to some of the conversation that's going on, certainly on social media and emails I've received where parents are saying, okay, I'm not comfortable with this. I'm unenrolling my child. I know it's only been since yesterday morning, since your letter went out, but have you heard any alarm bells? Are you hearing that there's families now unenrolling, or is it too soon to have an answer to that?
I think it's too soon, but yes, we've received some phone calls, certainly here at my office and several other offices that parents have said, well, I don't want my child wearing a mask, for instance. That could be one reason. There are several reasons why they might not, as you say, feel comfortable sending their child back into the full school environment. I understand that and can appreciate that. But we don't have the ability to give a full virtual option like we had last year. We just don't have that ability. We don't have the teachers that can monitor those students that are fully virtual. We were asked by the state, each LEA, to build a small virtual academy of one sort or another, which we have done. As you well know, we've got roughly 500 students enrolled in that. We're very excited about opening that and kicking that off this fall. And I think it will serve many of those students well. Certainly, we don't want parents to withdraw their children, but there are many reasons why they would. And I think many of those may try and take advantage of homeschooling, where they go through the homeschool process. Our homeschool numbers were up, as you know, last year. For those families that wanted to keep students at home as we started to come back to school. Those numbers started to drop off over the course of the summer, and it may very well, because of the variant and masking and other reasons, that number of families that request homeschooling or enroll their students in homeschooling may very well increase. We hope that they'll send their children back. We are incredibly excited about reopening schools, about getting students back. And I think we all want the same thing, and it's two parts. One is we all want our students back in school, right? That's where we know we can serve them best, in our schools, under our roofs, with face-to-face, in-person instruction, with teachers and students interacting with each other. We all want that. And we all want the health and safety of our students and staff to be paramount. And that's the reason that we have fallen on, and we are falling in line with what's happening around the country, and certainly here in the state of Maryland, with the overwhelming majority of the school systems going back with masks, because it will allow us to go fully in person and provide as much of that health and safety as we can in the given circumstance. Short of that, we'd have to go back to some kind of hybrid where we can have limited number of students in the classroom and in the school. And we don't want that, right? I'll go back to what we all want is the first part, which is all the students back in school. And so our conversations with the public health officials, certainly with Dr. K, and he talked to you and answered your questions earlier this evening, is in order to accomplish that, right now, masks next to vaccines are our best bet. And because we have a significant number of our students under the age of 12 that can't get vaccinated, and we have a number of students that are above the age of 12 that have not yet gotten vaccinated. I think the best number I saw at the high school was around 65% of those our high schoolers, those high school age children in the county. I can't say they're all ours because we have a number of high schools, public and private, but it's around 65%, 68%, which is a pretty good number, but it's not 70, 80, or 90%, which is where I think we would all feel better and safer about students at that vaccination level and then not wearing masks. So we're incredibly excited about bringing the students back and doing it as safely as possible, creating as much distancing as we can, given the current circumstance, continue with HVAC upgrades and airflow to make the air as healthy as possible, given each building, hand sanitization and hand hygiene, and continue to promote that among the students. Those are all levels of mitigation that we can put in place and still bring 100% of our students back into school. I know that's more than you asked, but I'm very excited. We are very excited about getting students back in school. It's what we all want.
And that's actually why I asked. I was going to ask you a follow-up to, simply speak to the families and who have concerns for various reasons. And I think you did that, and I appreciate that. And I also want to take this opportunity to extend, Dr. Arlotto, our appreciation to you and your staff for being available this last minute for the board and for our school community. I want to thank my colleagues for making yourselves available. I think we all recognized that a lot was happening in a short amount of time as far as information coming out, decisions being made. And so this was a very helpful forum for a lot of those questions to be answered that I know our community has. So thank you very, very much.
And thank you for your leadership, Ms. Ellis, in putting this together. I think it's a great use of our time and for the public to hear these questions and responses and the conversation because this is important. It's involving our children, our purpose, our why. But also let me reiterate something that you mentioned, which is things are changing. They're going to change some more. They could very well change between now and the start of the school year on September 8th, and they're certainly going to change into October, November, and December. Let's all hope that they're going to change for the better. Fewer restrictions in all these areas, and we can get back to what we all love, which is having our students back in buildings and full in-person instruction. Masks are not what we want. Masks are not what you want. But the advisement is that they work along with vaccines, and we think we can create a safe environment to bring 100% of our students back into schools. And we're very excited about that. So thank you again.
Thank you. And until that time, until that exciting day when those doors are open and students come back, I sincerely hope everyone enjoys the rest of their summer. It's been sorely needed.
Indeed. Thank you all very much.
Thank you. Ms. Schalheim?
Yes, sorry, let me bring that up. Yeah, thank you to Dr. Arlotto and staff, many of which are on vacation, as am I, or at least trying to be. And so very grateful to all of you. Madam President, I move that the board go into closed session to consult with counsel to obtain legal advice on the legal matter.
Is there a second?
Second.
Do I have consensus to go into closed session? Any dissent? That concludes our workshop. Thank you all for who attended and who watched. And our next regularly scheduled meeting will be August 18th.